I'm Dr. Jeff Donovan. I'm a dermatologist here at Sunnybrook Hospital. Today we're going to be talking about a group of conditions called scarring hair loss conditions. And these are a group of conditions that affect both men and women. There are probably over 20 scarring hair loss conditions. Some of them are much more common than the others. And these hair loss conditions occur in different ways. Normal hair loss, genetic hair loss, for example, occurs at the front of the scalp, at the top of the scalp in men, or in the middle in women. These scarring hair loss conditions can cause hair loss anywhere on the scalp, and patients often have itching, they may have burning, they may have areas of tenderness in the scalp, and these are often what prompt them to make an appointment with the doctor. Frontal fibrosing alopecia is a scarring condition that occurs in women. It generally occurs in women between the ages of 50 and 75, and this leads to hair loss along the frontal hairline, which is permanent. Central centrifugal alopecia is a scarring hair condition that occurs in 30% of black women, and it leads to hair loss in the center of the scalp. Patients sometimes develop itching in the area, but it may be completely asymptomatic. Lichen planopilaris is a scarring alopecia, or a scarring hair condition that affects men and women, usually developing between the ages of 30 and 60. Hair loss occurs generally in the front of the scalp and in the mid-scalp and leads to permanent hair loss as well. Folliculitis decalvans is a scarring hair loss condition which leads to hair loss in the top of the scalp. Patients develop redness in the scalp, they develop pustules in the scalp, and may even wake up with blood on the pillow, for example. And this too leads to permanent hair loss unless treatment is started. These photos that I've shown here are typical representations of what these hair loss conditions look like. I think the most important thing is that many hair loss conditions can look similar. The scarring hair loss conditions are thought to occur because of an immunologic reaction against the hair follicle. For some reason, the patient's own immune system is targeting the hair follicle. That causes the hair follicle to fall out, and what's left behind is a little scar. And that scar leads to permanent hair loss such that a new hair follicle cannot push itself up through that scar. And so the sooner we can detect these conditions and the sooner we can treat these conditions, the sooner we can stop the patient from losing more hair. But the hair that they've lost is usually permanent. Sometimes these scarring hair loss conditions can be diagnosed just by looking at the scalp, but oftentimes a biopsy is needed, and what a biopsy involves is putting in some freezing in the scalp, much like a dentist would freeze a tooth. We freeze a hair, and then we take that hair out using a very small instrument, and we send that hair off to be examined under the microscope, and then a formal diagnosis can be rendered. Generally, I recommend that patients that have itching plus one other symptom like burning or pain in the scalp should see a physician to inquire whether something else could be causing their hair loss besides just genetic hair loss. These conditions, again, are thought to be immunologic reactions to the hair follicle, and so the treatments are all centered around using medications that quiet down the immune system. Patients often will ask me, how do I know if the treatment is working? And the answer is that if a patient has itching and burning, let's say a 5 out of 10 or a 6 out of 10 in score, if they come back and see me in 3 to 6 months, I'll ask them, how's your itching now? If they say, my itching's now a 1 out of 10 or a 2 out of 10, then I know that the treatment is working. And generally over time, I also follow photographs. And what I tell my patients is that I want those photographs to look the same year after year after year. We're not able to get the hair back, but we're able to stop you from losing more hair, and that's what we follow with photography. So if the patient hasn't had any itching for 2 years and the area of hair loss remains the same dimensions for 2 years, then that patient may be a candidate for a hair transplant. Hair loss has a major impact psychologically on both men and women. It causes a lot of symptoms. So patients often have itching in the scalp, burning and tenderness, and it is sometimes very challenging to sleep at night, for example, with all the itching that's occurring. At times of stress or high emotions, these symptoms can worsen. Patients often ask, is it safe to put a wig on if I have a scarring hair loss condition? And the answer is yes. Oftentimes treatments will be done throughout the day, maybe once a day or twice a day, but it's fine to also wear a wig during that time. Sometimes a wig can increase the amount of heat in the scalp, And if you have a scarring alopecia, that can sometimes lead to a little more itching, but in general, a wig is safe to use if you have scarring hair loss. So it's challenging for patients to find other individuals that have these conditions. And there is an international society called the Cicatricial Alopecia Research Foundation, or CARF, which is an international support group for patients with these rare conditions, and it certainly goes a long way to helping these individuals understand more about their condition and cope better with their disease.